I'd like to welcome you for joining us today in making the announcement that we have with our new affiliation. We're thrilled to be joined by several leaders from the University of Utah, from Salt Lake City, to announce the new affiliation between our two organizations. I'd also, which is exciting by the way, so if you don't mind, it's a great day at St. Peter's. I know that I just saw Mary, I think I saw Kelly, I saw Russ Bell. I believe we have some of our board members here today with us as well. Would you all mind just standing really quickly so we could acknowledge you, St. Peter's Health board members? Thank you so much. Oh, and Pete? Wonderful. They have been an important part of this process, as you can imagine. So I'm just going to say a few words before I turn the microphone over to a couple of my colleagues and our guests from the University of Utah. And then we'll also, just so you know, we'll be available after the program. So if you have questions, you're more than welcome to come up, introduce yourselves to us, and then ask any questions that you may have. We're happy to address those. We'll try to keep our remarks relatively short, which, as those of you who know me know, that might be a difficult task. But I'll do my best. So, as many of you know, our vision is to be the gold standard for healthcare in Montana by 2025. In order for us to realize this vision, we need to have partners that share our same values and commitment to quality and satisfaction. While we will continue to partner with other health systems across the state of Montana, we have also chosen to affiliate with the University of Utah Health. Perhaps before I tell you what this partnership will do for our community, may I tell you what it is not. St. Peter's is not being sold to University of Utah Health. St. Peter's is not giving up local control or governance. St. Peter's is not going to stop collaborating and partnering with other healthcare organizations across the state of Montana. Those relationships and referral patterns are important to us and important to our providers, and we look forward to those continuing. As a matter of fact, University of Utah Health supports each one of these important principles and has demonstrated that with all of their affiliates across several states in the Intermountain West. Now let me share with you at least 3 ways this partnership will help our community, our patients, our medical staff, and employees. First and foremost, this partnership is about meeting local needs. St. Peter's administration, numerous doctors, all of our board members have worked closely together in evaluating this relationship. All of the hours, days, weeks, and months we have spent together with U of U Health have been with the intent to improve care for our community. I, like many of you, have family and friends and care deeply about this community. Go off script just a little bit. As many of you know, I have spent a lifetime living in different parts of the country. And I can't tell you how much it means to me just personally to be in this community, to be here with my family, to connect with old family roots that go back now over 100 years here in Helena. And so it's a pleasure for me to be able to work in this community, to work together with our doctors, with our board members to improve the quality of care that we provide. So like many of you and many in our region who need and want access to the very best care that can be offered, we're working together to make that happen here at St. Peter's. But we recognize that our mission to serve you, that as a small, independent healthcare system, we do not always have access to the resources that are wanted. In order to bring you the very best of what's available, we need to have strong partners who share our values and commitment to the local community. We have found this partner in University of Utah Health. By partnering with the U of U Health, we will, first and foremost, improve the quality of care we provide. This will be done by increasing the amount of support and resources we can make available to our physicians, providers, and other care team members. The quality of care will also improve as we accelerate our efforts to learn and incorporate best practices from a national leader in quality, satisfaction, engagement, and cost. This affiliation will increase access for our physicians and patients to highly trained subspecialists that are not currently available in our community or only available on a limited basis. University of Utah Health is one of the top academic medical centers in the country. Many of you may not be aware that they have been named as a top 10 academic medical center for the last 9 years running, and have been named number 1 twice during that time. Think for a moment what that might mean for a local community member who is facing a medical condition that requires national expertise and resources only found in large academic medical centers. Through this partnership, your local family practice provider or specialists will be able to more effectively help coordinate your care, and in some cases work together with the specialists from the U of U Health to provide as much of your care locally as possible, thereby bringing the expertise of a nationally ranked academic medical center here to you close to home. In addition to having a direct positive impact on patients and the quality of care we provide, this relationship will also benefit our doctors, nurses, and other staff members through increased access to education, training, and research. Medical knowledge is increasing at such a rapid rate that having a partner who is on the cutting edge of medical research and training will help us ensure that we're able to stay up on all of our treatments and care we provide the community. At St. Peter's, the patient must always remain at the center of what we do, and we are very pleased to have a partner, a new affiliate partner, that has that same focus and that same emphasis. They too care deeply about the patients, and about the local community. In our visits with them, they have shared over and over again the importance of providing care close to home and their commitment to supporting us in doing that here to Helena and to the local communities throughout our region. I'm very pleased and excited that after months of conversations and evaluating different opportunities that we have mutually chosen each other, that we share the values that we do. I, along with the others, executives and team members on our administrative team, with the board and both the system board and the 2 operating boards, all jointly are pleased to announce this affiliation with the University of Utah and with the University of Utah Health. So at this time, what I would like to do is I'd like to turn the microphone over to our Chief Medical Officer, Dr. Shelley Harkins, to share a few thoughts with you about where this relationship might be going, some of the benefits that we're already seeing, and then she'll begin to introduce some of our new family members from University of Utah Health. So Dr. Harkins.
Thank you. Good afternoon. What a special day this is. As Wade mentioned, we are in the midst of a transformation to become the gold standard in healthcare for the state of Montana. To do this, we have to have skill sets and experience on our teams. We already have exceptional providers. We already have skill sets, but we don't have every specialty. We don't have every skill set. To be effective, to be the gold standard, we need that. And our partnership with U of U is bringing what we don't have to our team. When our patients have a need that we cannot fulfill because we don't have that specialty or that skill set, we need to be ready. Not ready to send them away from their home, away from their social support, but to bring to them here in Helena all that they need. Technology is helping us do that. And I'm going to share with you 3 pieces of the technology platform that U of U is allowing us to provide for our patients. First, about 2 weeks ago, we rolled out Tele Icu. This is a secured audiovisual platform that allows our physicians and our ICU nurses to consult with an intensivist at the U of U. We see their face on the screen, they see the patient and the family can talk to them as well, and we provide exceptional care that way. We have been for years partnering with U of U for Tele Burn, something that we've had in our ER for quite some time, and it has been wildly successful. And now with this affiliation, we're going to expand our tele services to tele stroke. So in coming weeks, our ER physicians, when presented with a patient with a stroke, will have access to the stroke specialists at the U of U so that those patients can get exceptional care, the best care. We will know our patients are getting all the best care that's available. The patients will know, and the families will know that they're getting the best care available anywhere on the globe, right here in Helena. We've chosen a very strong partner to do this with. We didn't make this decision lightly. U of U, and Wade mentioned several accolades for U of U, but 25% of their providers are in the top 1% in the nation for patient satisfaction. That's remarkable. Another 65% of them are in the top 10% for patient satisfaction. And as already mentioned, they're top in the nation with quality, safety, and outcomes, all of the things we want to be. I'm very excited about this affiliation and about what this partnership will mean to the people in Helena and to our hospital, because we will be bringing all of the essence, all of the essential elements to our team to provide the care that we need to provide. And what better way to expedite our transformation to become the gold standard than to partner with an organization that already is. Now, it's my pleasure to introduce Tad Morley. Tad is the Executive Director of Outreach and Network Development at U of U Health. Tad?
Well, we are grateful to be here and excited about this partnership. I think that Shelley and Wade have described well the journey that you all, through their leadership, have gone on to select a partner to help you accomplish your goal of becoming the gold standard for healthcare in the state of Montana. And I want you to know this is our 23rd affiliate. We have had many opportunities to affiliate with other organizations, and we have elected not to do that because values were not aligned and our goals were not aligned. This organization lines up and matches up very well with what we want to accomplish together, and as is stated in the banner behind me, better together. Helen Keller said, "Alone we can do so little, together we can do so much." And that's really our goal. It is together we can accomplish the goals that we want to accomplish together as an entity, as in a partnership, and build on those relationships that have been going on for years. As was mentioned by Dr. Harkins, this relationship is not new to this organization. Tele Burn and other relationships have gone on for many years. We appreciate the warm welcome. Dr. Coyle, can you stand? There are many connections in this community with the University of Utah that are deep-rooted and are, so this is a natural combination of where we can work together. We are interested in your success, and I think that is demonstrated by the fact that we have brought many members of our team that are committed to this relationship. I would like to have those who have traveled with us from the University of Utah to please stand for just a minute. So these great people are members of diverse portions of the university. Jim Turnbull is here from he's our Chief Information Officer from the University of Utah. Dr. Kimball, whom you will hear from in a few minutes, is an intensivist and is also the medical director for our outreach and telehealth efforts. Julie Harris, I'd like to have you stand one more time, if you would please. Julie is going to be your main connection with the University of Utah, so she'll be a representative that is committed to the relationship that we are building here today. Bentley, would you also stand for a minute? Bentley will be working with physicians, particularly here in the community, and helping create connections and making sure that this relationship is accomplishing what we aspire it to be. Our goal is to really help you achieve your goals. So the affiliation agreement can take directions that are needed to best fulfill the designs that are needed in this community. And we realize, I've met many of you that are coming from outside the community of Helena and have interests in connecting and strengthening your relationship with St. Peter's. We would like to help accomplish that as well, so that your local health care can be what you need here. And then if a patient needs to receive care outside of the community, that's done in a way that's collaborative with your local physicians, and in a way that communication is seamless. So we are thrilled to be here. We are thrilled to accomplish this goal of being better together, and look forward to exploring and going down this path as we identify what that means and what will be best for our combined efforts and mutual interests. So with that, I am honored to turn time over to Dr. Ted Kimball, who's the Medical Director of Outreach and Network Development.
It's really a pleasure to be here. I'd like to say that all our affiliation announcements had as much enthusiasm as this one. This is truly spectacular. Thank you. Thank you for having us. I remember last spring we were talking about, Dr. Harkins and I were talking about when we had our first meeting, and I think it was last spring. I remember coming here, and usually when we come initially, there's a little bit of trepidation, there's a little bit of wondering exactly what this partnership will mean, and a little bit of hesitation. And that was literally absent. When we walked in, there was so much enthusiasm. The homework had been done. The goals of becoming the gold standard for Montana for this hospital had already been set. It was very clear. And the work to do that and affiliate with us had already been vetted. And so when we walked in, I had a sense of enthusiasm that I had never felt before in one of our affiliates, quite frankly. So I am not surprised that there's this enthusiastic group here today to welcome this final step in the affiliation. I'm not surprised that we have a fan like Dr. Coyle over here all dressed up. It made me think of the recent game. How many of you saw the recent game? The game. He was there. So I attended with a friend who is a BYU fan. Sorry, Wade. For the first 3 quarters of the game, there was this smirk on his face that, because in a sea of red, just crazy people dressed just like Dr. Coyle, as the team went down 20-0. But then at the end, he sort of had to partner up with me to survive because he had to get out of the stadium after what was a terrible loss for the other team. But that partnership made me think of that. The partnership that we have here is one that's not dissimilar. We will work together. We appreciate all the accolades that have been spoken about the University of Utah, but I truly believe, and I know this because we've just finished the 4th Tele Icu consult in less than 4 weeks, with your hospital, that you here at St. Peter's can get 98% of gold standard care right here. And it's that extra few percentage that the University of Utah will bring to the table to help. And there's a whole bunch of those in-betweens where we can work together. I have the opportunity to work in an intensive care unit where I can walk down the hall and speak to one of the lead figures in the nation in infectious disease, or one of the lead figures in the nation in gastro diseases, hepatobiliary disease. And that's just what comes with an academic center. we're hoping to bring that here to you. And one of the great things that has come through the Tele Icu program and the Tele program is not so much that we've seen more patients coming from our affiliates to our hospital, but actually a decrease in those patients. And one of the great things that we looked at with Tele Icu demonstrated that we had patients that were coming down to our hospital that were being discharged within a couple of days from our ICU. And when we introduced the Tele Icu programs into those institutions, that number went down to 0, meaning those more complex patients were being cared for with their families, in their homes, in your hospitals, and that's the goal. That's truly the goal. So the Tele Icu program new, the Tele program has been here, the Tele Stroke program coming. We look forward to a whole bunch more of these partnerships and specialties. We're excited to be here. I really do want to tell you that I've been so impressed with your CMO, Dr. Harkins, and your leader, Mr. Johnson, I should say, Wade here. He is a remarkable man, and we've watched him and his leadership. And I don't want to embarrass him, but I think Helena is very lucky to have him here. And we look forward to working with all of you in the years ahead and celebrating a great collaborative effort here. Thank you very much.
Thank you. Thank you to all of you for your comments that you shared. Once again, we're just really thrilled that we are now an affiliate of University of Utah Health, and all that it will be able to bring our community and our organization as we move forward to become the gold standard in healthcare for Montana. Thank you for all of those that have attended. We are going to actually this afternoon here in a little while be taking a tour with some of our friends from the U throughout the facility, just to give some of our staff an opportunity to meet them and say hello and congratulate them on this new partnership that we have together. So once again, I would like to thank all of you for being here, for your support of St. Peter's Health, and for the work that we have moving forward. We're absolutely thrilled to be able to provide care in this community and to take care of all of our friends, family, and neighbors. What a privilege it is. So thank you so much for your support, and we look forward to the future being better together. Thank you.